What's good, everybody? Back with another video. It's been a minute. Today we're going to talk about a medication I take called Quetiapine, brand name Seroquel. It comes in extended release and regular release forms. Doses ranging from 12.5 to 800 milligrams, which is a pretty big dose range. Quetiapine is an antipsychotic drug. I take it for bipolar schizoaffective disorder. It helps. Glasses are broken. Don't judge me. It helps because bipolar schizoaffective disorder would be a combination of bipolar disorder with varying symptoms of schizophrenia or a schizophrenia spectrum disorder, such as schizotypical disorder, or what's that other one? Fuck it. No, so I take 25 milligrams twice daily as needed. Normally I save one for at night with my other sleeping medication. And the other one I will just take throughout the day as a mood suppressant. I was on a dose of 350 at night with 125 as needed throughout the day as my antipsychotic, but the thing about that is my legs were getting kind of numb, and Seroquel is it's a unique antipsychotic because in lower doses, such as for me, probably about 25 to 100, will have a heavily sedating, and very sedating, almost reminds me of Klonopin without the blackout, and the body feeling is very relaxed. It relaxes your muscles, and Quetiapine stabilizes dopamine and serotonin. It works on both, which are both active chemicals for worsening symptoms for manic phases of bipolar disorder, bipolar mood swings, as well as positive symptoms of schizophrenia. Positive symptoms being hallucinations, voices, paranoia, restlessness, shakiness. These are called positive symptoms. And I find Quetiapine helps me a lot with those positive symptoms at a low dose. But as I was saying, it's unique because in a higher dose, any dose higher than about 100, like I just said for me, it is more of a mood stabilizing drug. It is a second generation antipsychotic, which are made to have less side effects than the first generations, like Thorazine, where, people are zombified, as they would portray in movies and such things. And I've tried Thorazine, and it's not like that for me. I only did it once. But the thing is, in a higher dose, it works more like a mood stabilizer, Quetiapine. But the problem is, I already take mood stabilizers, and like I was just saying, it reminds me of these newer generation antipsychotics where they're made to be less sedating, a little more activating and stabilizing. But in my case, where I have the manic side of the bipolar part, as well as the positive symptoms for the schizophrenic part, something activating is not what I need. I need sedation 9 times out of 10, because I really don't tend to have what you would call a depressive phase that often, at least with these meds now. So that's why I had to get off that 300. In addition to that, like I said, it wasn't helping me sleep as much at such a high dose. My legs were getting numb, and I'm not knocking the drug, but I think that dose for me, it just didn't feel right. It didn't feel like pardon me, it didn't feel like something I needed to be putting into my body every night. I didn't think I needed that high of a dose. So I got a new doctor who allows me, unlike my last doctor, to actually be on 2 antipsychotics at once. And that's helped me a lot. So having the quetiapine take is needed, where if I am feeling kind of out of it, I might not always need it throughout the day, even at night. If I'm getting tired without my meds, I won't take it. And this is very helpful. It sounds like I'm talking about me a lot. I'm just trying to give advice here, or let you know my experience. I apologize for that. I try not to do that on this channel. But this is a review video. So at not having it every day, you don't build up such a tolerance, so it is more effective when you do take it. Yeah, exactly. There's no other way to put it. It's more effective if you don't take it every single day, because you don't have a tolerance, which really helps me. And I feel like more doctors should allow other patients, I don't know why someone would watch this unless you had a bipolar or schizophrenic partner or child or brother that you're taking care of, or you work at a care facility, or you're a nurse maybe. But other than that, I don't see anybody else watching this besides someone inflicted with the disorder. So if you have said disorder, either one, it could be something to talk to your doctor about, because I personally have seen more progress in these past 2 months being on risperidone and Seroquel take as needed, both. I've seen more progress these last 2 months being able to take one for certain symptoms and take one for other symptoms than I have probably the whole past year that I've been in treatment and been diagnosed. So it kind of amazed me, and my new doctor, she was really impressed too. She'd never seen a patient respond like that, although obviously you can tell from probably listening to me talk, I am what you'd call a higher functioning. I live by myself, pay my own rent, etc. I am on disability, but that still is my money, and I do have a job. A lot of people with this disorder are unable to work, even if on a good day they seem normal, or in a good mood. But quetiapine can also be used to treat autism, or Asperger's disorder, any autism spectrum disorder. It could be used to treat off-label, but it's still effective. I take some off-label medications, and they help me a lot. I'll be making another video about those right after this one. But it's a drug that has a wide array of uses. Quetiapine is, and it's also just used for insomnia, or used for any sleep problems. Sleeplessness, narcolepsy. I did read about, it wasn't a medical article, but I read someone with narcolepsy, ironically enough, took quetiapine at night to get a deeper sleep. Therefore, they weren't having to fall asleep throughout the day, or didn't as much. I know there's no cure for narcolepsy, but that would be a horrible affliction. Couldn't imagine that. It doesn't seem like something that would be that problematic until you're working a high-stress job like our boy Homer Simpson. But back to the quetiapine, of course. I do have some leftover 50 milligram tablets. 50 milligrams was my starting dose when my family doctor diagnosed me as just bipolar before I went to a mental health facility and got my actual diagnosis. But the 50 milligrams, they help a lot, but I find 50 to be almost too sedating, and I don't like to use zombified as a term, but I find myself bumping into shit or knocking shit over, passing out in my chair, straining my neck, or passing out eating food. And food, that's another thing. Any dose Even if I take half of one of these, it's the munchies. It's the fucking munchies. You eat. I've probably gained 30 pounds, which was actually, it's good. When I first started treatment, I was 170. My normal weight's about 190. Right now, I'm about 200, which is a little overweight for me, but weight gain is it's probably the most common effect besides drowsiness of the antipsychotic medication. Another thing to watch out, long-term usage in certain people could cause what they call tardive dyskinesia. I believe that is uncontrollable shaking. If that's wrong, I apologize. I forgot to look that up specifically before this video, but I'm 11 minutes in. I'm not making a fucking new one. I'll put it in the description. Other than that, though, the only thing I could really say about Seroquel that I haven't already said in these exact words is that, it's helped me the best having a take as needed, not every single day, because of how drowsy it makes me. Some people are always at that level and having constant visual hallucinations. So, of course, some people probably do need a daily dosage or twice a day dosage. The twice a day dosage would normally be a small dose in the morning and a slightly larger dose at night. Just to recap this, in higher doses, like I said, for me, and I read this online, in most people it'll stop being so sedating and start being more of a mood stabilizing antipsychotic. And so sometimes that's not what you need in a case like me where I already take mood stabilizers as it is. So, to recap, I do recommend this drug. I do recommend anyone that has heard things that they might find helpful to ask their doctor about this drug. I forgot to say this at the beginning of the video. I, of course, am not a doctor. Consult a doctor before you go taking anything. Don't take anything you're not prescribed. Don't mix this with alcohol. Don't mix it with other downers unless allowed by your doctor. I have some other downers I take with it, prescribed, of course, because my doctor allows it. If you abuse drugs, don't mix Seroquel with any other downer or an upper. Another thing about Seroquel, it will stop a psychotic episode caused just by drugs. So, a bad trip from LSD or mushrooms, mescaline, DMT, an amphetamine psychosis, a cocaine psychosis, Seroquel will neutralize the serotonin and dopamine and effectively stop that and level you out, if not put you to sleep, even more effectively than a Xanax would. Or, you see drug abusers would maybe take opiates to calm themselves down from a bad trip. It would be a lot more effective than that. Should anybody have a bad trip and be sent to the emergency room, if you're there enough, ask for a Seroquel or an antipsychotic. This is very good advice to know because even in someone, especially someone with an undiagnosed mental illness who were to take a psychedelic drug, this could cause a severe episode, completely lack of control. This is why you hear these horror stories about people jumping off buildings thinking they can fly. Delusions are not a normal side effect of psychedelic drugs like most people think that they would be. They would enhance people who already have delusions or hallucinations. A lot of people don't know that. Seroquel is very handy for that. There's a line in Fear and Loathing in Las Vegas where the dude took a whole sheet of acid, and Hunter S. Thompson says, there better be some Thorazine in that bag or like you're fucked or something like that. And I read that and I was like, yeah, that's probably right. This dude knew what the fuck he was talking about. That's my incredibly drawn out review of Seroquel. I hope you guys found this video to be informative. And I hope that if anyone thinks this might be good, you were to talk to your doctor about it. Thank you guys for watching.